Hello, everybody. Welcome to Sunday night. Yes, it is OAFP Bite-Sized Learning. I am your President-Elect, Dr. Mike Sevilla. Yes, I'm back. But, you know, we have another great interview coming up in just a few minutes. But before that, I do just want to have a few OAFP-related announcements just to start things off. First, there's still time to register for the OAFP annual meeting Sunday, August 9th at 7 p.m. Please register. You just can't show up. You have to register first at ohioafp.org. We're going to have a lot of fun things. I know you think it's a lot of boring business things. It's not. It's going to be fun stuff. And you'll see me sworn in as president, and you can make fun of me, and it's a good time. Secondly, especially for the residents and students out there, it is National Conference Week. So obviously we can't be there, but one of the things that we're going to recreate is the Ohio-only reception, and it's going to be Thursday night, July 30th at 7:30 p.m. But you have to register as well. I think that's at ohioafp.org, or you have received an email to register for that. So there's going to be a lot of fun resident and student stuff that night. And also, just a little plug for myself, that I will be running a panel Saturday morning on a main stage, a virtual main stage at National Conference, where we talk about family medicine stories. There's a panel with 3 other great family physicians, so you can't miss that. Also, our friends at the OAFP Foundation, they're having a virtual family medicine party that is going to be August 7th. That's going to be the Friday night before the annual meeting at 7 p.m. You have to register for that as well. And there's going to be fun things from the foundation as well. I'm going to highlight some of our award winners for the year. And there's still time to register for that Past President Quilt. And that's at ohioafp.org as well. And finally, we have merchandise. That's right. OAFP has merchandise. We have shirts. We have masks that say doctor's orders on it. Our t-shirts, virtual conference t-shirts for our annual meeting. All the proceeds go to the OAFP Foundation, which funds programs like the Medical Student Preceptorship Program. So all of that stuff, any questions, go to ohioafp.org. So let's see here. So let's bring in our guest. So I guess I don't like, really long introductions, because we could be here for an hour introducing our guest. She's right there. Dr. Natasha Bouyan. I'll just say the Western Regional Director for One Medical. So that's one of your hats. So welcome, and hey, it's great to talk to you.
I'm so excited to chat with you today. Thank you so much for having me here.
We have like 1,000 topics that we can talk about. So, but first, let's kind of check in and, how are you doing through this? Like these past few months. Share a little bit. We're going to talk a little bit about your important jobs in a few minutes. But just how have you been doing? How you've been doing with self-care? How you been doing with all that?
Yeah. Oh, thanks for checking in on that. I think that's such an important topic for physicians to check in on, especially family physicians, because we give so much of ourselves to our patients and our career. And so I've been hanging in there. I mean, I will tell you that on my worst days, what I tend to lean on is my colleagues. And I'm so impressed by my colleagues. And I will share some details about how we've responded in this pandemic. But I find that even on my toughest days, I look around myself and I find there's so many people who are committed to taking care of patients, committed to making the healthcare system better, even small acts of kindness. And you see it in people who are clinicians, and you see it in people who are not clinicians, our phlebotomists, our admins, people on our tech team. And so I think I'm feeling really inspired. I'm feeling cautiously optimistic about the future. And I think hanging in there is probably the best way to phrase how I'm doing.
And I probably didn't mention that you're in Arizona. So just to kind of frame it for our audience, especially here in Ohio, where in Arizona are you? And, what's the temperature where you're at right now?
Oh, the temperature. It was 108 degrees today where I'm at. And I have to tell you, we have 2 AC units in my house. And one of the AC units actually broke down earlier today. So there's like half of the house that's really warm. And we're scrambling to get an AC person out here. But yeah, a little bit of background about me, Mike, that I am happy to launch into. I am born and raised in Phoenix, Arizona. So I'm from Phoenix. And a little bit of my journey into medicine and into family medicine, I initially thought that I was going to pursue a career in journalism. So I went to the University of Arizona. I worked at the Arizona Daily Wildcat. That was the daily student newspaper. And I was like in the grind. I was like calling up professors, getting the scoop, working on deadlines, writing. And eventually I got assigned to the science beat. And it was interesting working on the science beat because I would cover a lot of medical stories, so a lot of medical innovations. And my editor always said, make sure when you cover these medical innovations, always get the patient perspective as well, the people who are the recipients of these innovations. And so part of that was I got to talk to a lot of patients. And one of the stories that I'm always going to remember is the University of Arizona. There was a doctor there, Jack Copeland, and he was the pioneer of the artificial heart. And as the pioneer of the artificial heart, I got to chat with him. And, you know, there's people who are on a transplant list and many of them don't make it. And there was one patient that I had a chance to talk to, and he had the artificial heart and he had had it for like 17 days at that point. He was really excited. And so when I was talking to this patient, I was like, well, tell me about your journey into getting this heart. And what the patient told me is he's like, you know, I'm going to credit Dr. Copeland, this doctor, for saving my life, but I really credit my family physician for giving me quality of life. And he said through the entire journey, his family physician was the one person who asked him, what are your goals? Like, what are your health goals in life? What are your overall goals in life? And he just said, look, doc, I just want to be able to play poker with my friends. Like, that's really what I'm here for. And so it was great to see that he had that relationship with his family physician. And it was that person through this whole journey that treated a patient like a patient. And that was one of the things that inspired me. And so, you know, midway through kind of the start of my career, I decided to pursue a career in medicine instead. And I think about all the things that drew me to journalism. Those are the same things that draw me to medicine, in particular family medicine. So we ask people questions. We're trying to discover the truth. We're connecting with other people. We're sharing other people's stories. And we're just trying to make the world a better place. And I love that about journalism. And now I love that about family medicine.
Oh my gosh, wow. There's so much for me just to kind of follow up on there. It's
Yeah.
just like, I had no idea about the journalism angle. That really kind of really fits to a lot of the stuff that you're doing in media, which we'll get to eventually during our talk, because I do really want to dive into that and how family medicine and how family docs really should be participating more in media. So that's great. Wow. Well, let's, where do we want to go through? So, you know, I kind of, you know, or, you know, OAFP staff really is advertised this as COVID-19. So let's really kind of dive into things here. So you're in Arizona there. So why don't we just start our conversation, you know, backing up to like, you know, March time. And I know what was happening in Ohio, and everybody, you know, in the audience pretty much in Ohio knows what's been going on, but kind of share your COVID story in your community from March as far as what was happening back then, and kind of weave your way up until you know, almost today.
Yeah. And actually, you know, the journey of COVID in Arizona, it's a really good lesson for other states. And I'm glad people in Ohio can hear our story, because there's a lot of lessons that other states can apply as well. And I might take it even earlier than March. I might actually take us back to January. So I don't know if a lot of your audience is aware, but one of the earliest COVID cases in the United States was actually in Arizona. It was actually in Phoenix. So end of January, we had a positive confirmed case, and it was one of only a handful of cases in the entire US. And that COVID case worked the way public health should work. That person was identified early, that person was isolated, there was contact tracing, and that person recovered, and we weren't able to actually identify other cases from that initial case in January. And so then you kind of fast forward, because then it was a little quiet in Arizona a couple of weeks after that. And then you fast forward to March. And what happened in March is cases started to skyrocket around the nation. And other states were pursuing stay-at-home orders, shelter-in-place orders. And, in Arizona, it was interesting because a lot of this, was driven by, a lot of our public policy was driven by politics as well. And we have to just acknowledge that. And so in Arizona, we were kind of grappling with, making sure that people were limiting dine-in and trying to do takeout. There was a lot of half measures. And we were actually one of the last states to have a stay-at-home shelter-in-place order. So I don't think that happened until toward the end of March. And so then at the end of March, we've got that stay-at-home order. And from March until May, our cases were staying, fairly stable. Cases were climbing in a small kind of way, but they were pretty stable. And then in Arizona at the beginning of May, this is where we veered off from the rest of the nation. So Arizona ended up being one of the first states to reopen. And we ended up reopening on May 15th. And I think that there was some White House guidelines of when states should reopen. And there was two main categories of when you could reopen. One was, are you seeing a decrease in the number of cases over a 14-day period? And two was, are you seeing a decrease in your percent positive of cases over a 14-day period? And what happened in Arizona is we were not seeing a decrease in the number of cases. Our cases were actually climbing up during that period. But what we were seeing was a decrease in our percentage positive. And I think here is a lesson in data and how a lot of people will be looking at the same data and extrapolating different information from that. And I think we're seeing that right now in this pandemic. There's so much information about there, and a lot of people can use data to fit their narrative and to fit their agenda. So what happened in Arizona was that percentage positive, it included PCR tests, but it also started to include serology testing. And so with serology testing, I think you guys know that's antibody testing. There's a lot of people that were getting blood draws for antibodies, and a lot of those were negative, and some of them weren't, but a lot of them were negative. And so they were being included in the denominator of all of our testing. And so when you looked at our positive percentage rates of cases, that number looked like it was getting lower, but it was actually kind of a misleading metric. And so based on that metric, our state ended up opening. And so not only did we open early, we opened really fast. And this is what a lot of public health experts say right now. There's phases of reopening, you phase 1, phase 2, and in each phase, there's different mechanisms of how you go to the next phase. Arizona, it felt like it went from 0 to 100. It really went from, we were at stay at home, and then suddenly that following week, restaurants were open, gyms were open, bars, nightclubs, casinos, water parks, and for the public, it was actually a lot of a mixed messaging because the people in the public, they're not epidemiologists. They're not looking at case counts and percentage positives. All they know is, okay, the state is open. I guess it means that it's probably safe to go to the gym. I guess it means it's safe to go dining at a restaurant. And so what happened is a lot of our citizens, they were out and about. We did not have any sort of mask mandate. And so we really went from 0 to 100 in Arizona. And then you started to see that Memorial Day weekend. Cases were climbing up really 2 weeks after we opened, which makes sense because there's that incubation period of the virus. Cases kind of climbed up. And then Memorial Day weekend, I really think that was just kind of like an explosion because it was people who are out and about at parties. There was all these videos emerging of people like pouring champagne, not wearing masks, out and about, like huge gatherings, family birthday parties, baby showers, all kinds of things happening in our state. And then cases were just ticking up. And then it really did feel like there was that explosion. And I think in mid-June, a lot of people in public health were kind of sounding the alarm, and they were like, this is not the way it was supposed to happen. This is not the way we should have opened. And I think at that point in mid-June, our governor felt like, okay, what do we need to do to put the brakes on this? And, the governor himself did not implement a statewide mask mandate, but what happened toward the end of June is mayors and local cities essentially had the authority to put in mask mandates themselves. And so that led to kind of these patchy mask mandates. Like some counties implemented mask mandates, some cities implemented mask mandates. Those were all good things. They were very, very much appreciated and applauded. And so we did have those mask mandates in place. And then the governor took some incremental steps, said that we're going to close down gyms, we're going to close down places that are bars and nightclubs, but we kept indoor dining at restaurants open, we kept casinos open, banned gatherings of more than 50 people. So I think there was, measures that happened. And I think, with COVID, any sort of incremental measures, we will see a result, right? Anything that we do is incrementally going to help. And, on one end, you have completely shutting the state down. On the other end, you have like the small measures. And so that's actually what we saw in Arizona. But I think from there, where we're at right now, I think the state of Arizona is that our percentage positives continues to be high. And so testing and widespread testing continues to be an issue. And our PCR rates are variable. So there's some people who are celebrating a plateau in our cases the last few days to maybe week and a half. And I always tell people, take that plateau with a grain of salt. And the reason why is we're kind of plateauing at 3,000, 3,500 cases a day. When you go from 0 to 100, like we're plateauing at 95 miles an hour. And being at over 3,000 cases a day in a state our size, that's also unacceptable. And so we need to figure out, how do we get that plateau to move down to an acceptable number of cases? The other big caution with our PCR and our percentage positive, it's really just the state of turnaround times for labs. It's an issue in Arizona, but it's actually an issue nationally right now. Turnaround times for labs, it's increasing, and it's been increasing through June and through July. We're finding that a lot of private labs are not able to keep up with the demand for testing. And so as a result, it's reasonable to get results in 2 days. When you get test results in 2 days, you're able to engage in contact tracing, you're able to isolate people. There's a lot of impact on having timely results. What we're seeing now is patients are waiting 7, 8, 9, 10 days to get their test results back. And I saw a dashboard that there's some people waiting over 14 days to get their PCR test results back. And so that leads to some loss of confidence in the data that we're seeing now. And it really hampers our ability to do any sort of meaningful contact tracing. And I think on that topic, another area in Arizona that's been a sore spot, but also nationally, is we haven't had good contact tracing data. So we don't actually know where are the outbreaks. I think we can assume, and people presume that they are in places like nursing facilities, correctional facilities, gyms, large gatherings where people aren't wearing a mask, nightclubs. We don't actually have clear data that points to that. And there's a lot of people in the medical community where we have our suspicions that hotspots are likely family gatherings. And we would love to educate our patients more on that indoor birthday party, that indoor baby shower, that family gathering. That is actually what's leading to a lot of cases, but we don't have the contact tracing data in a way that's robust enough to point to that. So contact tracing, testing, these continue to be areas. I think what we're seeing nationally is because testing continues to be an area that private labs are struggling to keep up with, is we're almost getting back to a place of rationing tests once again. So, back in March, back in April, a lot of people who had symptoms did not have access to a PCR swab. And the reason why, it's for different reasons than now. At that time, there wasn't actually enough supply of testing. There was unstable PPE for people in healthcare. And so at that time, we had to ration testing. And a lot of people in healthcare had to say, look, if you've got symptoms, just stay at home, just isolate and quarantine. But we don't really know if you actually have it or not. We're reserving our testing for the most vulnerable populations. And since then, we've learned that widespread testing is one of the public health pillars to fighting this virus. And countries that have fought this successfully, they have widespread testing. And when I say widespread testing, you've got to test people who are symptomatic, but you've also got to test people who are asymptomatic that might have had a high-risk exposure. And you've got to test essential workers, people in grocery stores, food services, servers, people who are continually being exposed. We need to know what their status is, because oftentimes they're patient zero and they're the ones who are infecting others. We test people for pre-op. So widespread testing is a tenet of this pandemic response. And right now, because of the capacities for testing and how it's limited, we're seeing a lot of states saying we got to dial back on who we prioritize for testing, and we have to reprioritize at this point. And that's something that really worries me, because that will also not give us a clear picture on who's actually infected.
Yeah, I mean, I can't agree with you enough about that. And the story, you know, is very similar. You know, here in Ohio, you know, back in March and April, you know, they had targeted testing, you know, testing with people with symptoms only. And then there was a time, even, you know, big institutions like Cleveland Clinic, they had the drive-through testing, and then they ran out of tests, and people got angry about that, and they weren't getting their test results. And you know, where it stands today, I mean, I can't speak for the whole state, but at least for my patients, you know, we're still seeing 5 to 7, 10-day delay in getting those nasal PCR tests back. And you're right. I mean, the key is enough tests, but testing has always been an issue. Getting access to tests, timely test results, where can you get the tests? And you know, we are going to talk a little bit about schools coming up too. But you know, schools, sports, employers. Exactly. I mean, it is a big problem, but something that is really interesting that I've been following, especially with your work at One Medical, is that it looks like that your work really has been taking a leadership role in the testing realm where you're at. Can you describe a little bit about that?
Mm-hmm. Yeah, and I can definitely describe what my actual role is at One Medical, so viewers are able to understand better. So I'm, of course, a family physician, and I do see patients. I engage in patient care. We think that's very important for leadership. But my role at One Medical, I'm the regional medical director of our West Coast market. So I'm based in Phoenix, but I'm the regional medical director for Phoenix, LA, San Diego, Seattle, Portland, and Orange County. And so it's interesting because I do have this more global perspective on what's going on in Arizona, but also what's going on in Oregon, what's going on in California, what's going on in Washington. That's something that we look at really, really closely. And, you know, part of my role, it's driving clinical innovation, it's growth, it's strategic partnerships. I support digital and in-office care delivery, market launches, which we've launched Portland and Orange County since this pandemic. So we are still, of course, focusing on growing and making sure that we are delivering excellent primary care to our patients. But I also get to work with several cross-functional teams in my role. So I get to work with our product team, strategy, recruiting, information technology, real estate, business intelligence, product, member experience, quality and value, data science, which I love. And so there's a lot that I do in my role. And then another big part of my role, it's leading leadership development for our clinical teams at One Medical. So supporting our office medical directors, virtual medical directors, district medical directors on our phlebotomy team. So it's interesting thinking about like how large One Medical is. And for people who don't know, it's an innovative primary care organization in the United States. We've got over 85 offices, and we're in 12 different markets. And really, our bread and butter is delivering excellent primary care. And when I think of our response to this pandemic, I'll always remember this. We did our first COVID test March 7th in Seattle. And the reason I know this is because I was actually in Seattle when that happened. So I travel every week for my role, but I have not during this pandemic. And so prior to March, really every single week I was traveling and visiting all of our markets. And so you remember that Seattle was actually the first epicenter of this pandemic. And Seattle had an outbreak in a long-term care facility. And Seattle had a number of cases, and they were just growing really quickly. And so we recognized that we needed to launch testing. That was one of the big things that we wanted to do. So we launched testing in Seattle. And I remember being in Seattle at that time. It was a really surreal experience because it was, you know, you knew that the COVID cases were increasing. And I think the second I got there, I was thinking, maybe I shouldn't have flown here. This is probably not a good idea. But even then, we knew to wear masks. So people in the airport were wearing masks. We knew to practice hand hygiene. And we need to practice physical distancing. I think those are things that we've learned with a lot of these infectious illnesses are just tried and true methods. And so we knew to practice that. We implemented that very quickly at One Medical. We launched testing at One Medical in Seattle, and then the rest of the nation followed very quickly after. And one of the big things that we also did was launch mobile testing sites. And so a lot of our regions had mobile testing sites because we found it was a way to test people in a high volume manner in a way that was safe and outdoors. And part of that was also securing adequate PPE, making sure that our teams had adequate PPE in order to be safe while we were testing. And then another big part of it was just our clinical learning team really mobilized and talked about, what is our philosophy? Like, who do we prioritize for testing? Who do we test? What CDC guidelines are we following? And it was nice to just have our teams get together too, because the other thing that was happening at One Medical is, because we're national, all of these different state departments of health, they were emerging with different guidelines. And so Arizona Department of Health would say something different than in Oregon. And so for us being a national organization, we were kind of looking at public health experts within our organization, working with public health experts within health systems partnerships. So we have a lot of partnerships of health systems, looking at CDC guidelines, Department of Health. So it was really like mobilizing a national primary care organization was kind of this incredible feat. And I think what a lot of people say, a lot of our clinicians are always so proud of, we created so many resources for our patients. So we had templates for our patients. We had external facing blogs that clinicians were continually evaluating to make sure we had the latest up-to-date information. We were getting questions from our patients at that time of, is this contagious to my pet? Will my pet give it to me? Because, there's so many unknowns that people were just so anxious. Yeah, we were creating tons and tons of FAQs for our patients, templates for our internal teams, algorithms for our internal teams, securing testing, and all the while still delivering really good primary care. Because we have to remember that, like, we are a primary care organization. And of course, we had virtual platforms so people could do video visits with their PCP, and that was great. But our doors never closed at One Medical. Our offices always stayed open, because we recognize that the issues that make complications of COVID worse, uncontrolled diabetes, uncontrolled asthma, COPD that's uncontrolled, those are bread and butter primary care that if we can get those issues under control, people's outcomes from COVID will actually be better. And so we really believed that we needed to still be operating throughout this entire pandemic. And I think that's one of the things that we are the most proud of.
Now, as I shared with you beforehand, excuse me, Ohio just this week, the governor mandated masks statewide. Before that, it was really a county by county basis. I know there were some cities in Ohio that were having that as well. And I was following this story in Arizona, and I think there were some other health professionals, maybe even early on, April, May, June, who were really trying to encourage the governor, encourage the government to have this mask mandate. How's that work going? How's that education going of the health officials and of the government out there?
Mm-hmm. Well, I will add that we know that masks work. So there's actually a large body of data on this, and Health Affairs did a really great study on looking at states that have mask mandates and comparing them to states that don't have mask mandates. And they found substantial evidence that places with mask mandates do reduce their transmission. I think the reason that we also are passionate about masks is if you look at places like Japan, and there's a couple other places, they didn't need to shut down their entire economy. Like, for a lot of people, in the beginning, everybody just wore masks. Like, it was very cultural. And so I think there's a piece of this where it's like, if we all can get on board and we can all wear masks, it actually is helpful, because there's kind of our lifeline to feeling that sense of allowing places to stay open and places to operate. But culturally, people in the US are against masks, at least certain patches of people. And again, that's taken kind of a political foothold. In Arizona, to this date, we still do not have a statewide mask mandate. We have asked our governor for one, but he has not implemented one. What we do have in Arizona is just the patchy local and city ordinances. And so because of that, people are wearing masks, but it's variable. At One Medical, we did tell all of our patients they are expected to universally mask to be seen in our offices. And we find that when we have conversations with patients and we provide them the education about why masking is important, people do comply. But for a lot of people who don't have the education, they don't have the access to information, some of them are only getting really narrow pieces of information. And, I'm hearing these myths about like masking is unsafe and like carbon dioxide poisoning and all these different things. And it's really like you're thinking of people who are not getting accurate information. And this is why I've said constantly from the beginning of this, we really need physicians and public health experts out there talking about this, and not politicians, because politicians, they again use data for their agenda, and they might not even understand the data on their own. And I think politicians can use public health experts and physicians to determine policy. But what we're hearing is like really mixed messages from politicians, and that's confusing the public.
So my guest on the line is Dr. Natasha Bhuyan, who's a family physician in Arizona. And by this time's going by quickly. Let's, because I know it's on the minds and thoughts of everybody nationally right now is schools. So what has been the talk, and what has been the thinking out there in Arizona when it comes to back to school and that whole thing?
Yeah, and this is, again, a hot topic around the nation as well as in Arizona. And I always tell people, back to school is not a national conversation. This should be a neighborhood conversation. And the reason why is, of course, back to school should be driven by what is happening locally in that region and what does your data look like locally. And based on that data, that is what should determine what it looks like to go back to school. And I think what's happening in Arizona is it's just really unclear guidance. We don't have clear back to school guidance right now. We don't have clear metrics for what does it look like to go back to school. I think what I would love to see is just parameters of, in order for schools to open safely, this is what the percent positive needs to look like. This is what cases need to look like. This is what the RT needs to look like, and really have those metrics, because right now what's happening is school systems are kind of left on their own to figure it out. And on top of that, like, school systems have to look at the data on their own, which again, that's not fair to them. And they're kind of coming up with their own guidelines for actually implementing a safe opening. So, what you're finding is that there's schools that have resources. And of course, you can see the health disparities here, where schools that are in higher income area that have the resources, they're able to purchase things like HEPA filters. They're able to use additional classroom space to really space out the students. They're able to hire extra staff to disinfect the classrooms. They're able to put children into pods, and really they have the resources to implement safe opening. Where on the other hand, you look at schools that are in low income areas, they don't have those resources. And what concerns me is if we open schools too quickly without adequate resources, we're only going to exacerbate the disparities that we're already seeing, especially in Black and brown communities.
Yeah, exactly. I mean, it's just, I agree. It should be a local issue. And something that I'm a little bit embarrassed about is that I really didn't know the interface between schools and the public health system. And a lot of these having to do with your local health department, your county health department, and your state health department, trying to work with all of those entities. I know that they've worked with them on different type of, epidemics and pandemics in the past, but this is really an opportunity for these local communities to work with your city and county health departments, trying to work together on this. A school should not be, and a school district should not be out there by itself trying to figure out these sometimes complex medical issues. Yeah. As people know, or may not know, and my wife works in education, and her whole summer has been trying to say, hey, how is this school district going to come back together, and how do we not only keep the kids safe, but keep the staff safe? How do we communicate with the community? How do we try to manage a lot of the anxiety that's out there? And what if there is a case that happens? How does that all happen? So it's a very complicated issue, and obviously, each community is different, and you can't make a rule for everybody. But it is what is on the minds of everybody, especially right now at the end of July.
Yeah, and it's interesting. My sister's actually a school teacher. She's an elementary school teacher, and she teaches in Virginia. And what they're doing is very different than what's happening in Arizona as well. And I think everyone's trying to figure out, how do we keep our staff safe? How do we keep our students safe? But then also thinking about parents and parents who are working. I mean, that's been another issue is parents, their offices are often open, or they are working. And so a lot of them are like, how do we make sure that we're able to balance kids potentially being at home and being a working parent? I mean, it's an extremely complicated issue. And I almost tell people, we just need to have forgiveness for each other and sympathy for each other. And just like, things are not going to be perfect. Like, work is not going to be perfect. Like, being a parent's not going to be perfect right now. And can we just have a really long runway for forgiveness, because this is an area that's still unknown. And then the other thing I was going to add to this, Mike, it's again, looking at data. So it's again, this idea of everybody's going to look at the same set of data and walk away with different conclusions. I think that's so well highlighted in even thinking about things like death rates. Like that's something we talk a lot about in Arizona and in the national discourse. And, the death rates can mean so many different things. So you could be talking about deaths per capita, which is kind of normalized for different countries. Or you could be talking about the case fatality rates. And the case fatality rates are deaths over the number of confirmed cases. And that can change based on how much testing you are or aren't doing. And you can also think of the infection fatality rate, which is deaths over all presumed infections. And so when you look at how complex the data is, I always tell people, pointing to one data set, that's not going to give you the picture of what's happening with COVID, because it's so complex that we can't just point to one metric and say things are great or things are terrible. Like we really need to understand the whole picture to know, like, does it make sense to start schools and how does that look?
Natasha, let me ask you. So, I mean, everything has just been so politicized now. And there's a lot of people in my community, who are really kind of, distrusting doctors now. They're distrusting the data. They say the data is bad, or the data is delayed, or they're double reporting things and it's coming out of the news. And, how do you communicate and how do we as family docs try to communicate this with our communities, try to get some trust back with our community people, with our patients, to say, hey, I'm really not trying to be political. I'm really trying to give you the science and the data, but everything's so political now. It's sad. I mean, it's just very frustrating.
Yeah, and Mike, you do a lot of media, and I do a lot of media as well. And this is an area that I always struggle with, where for my individual patients, it's a lot easier, right? So I've got individual patients that I can talk to, and they trust me because I am their family physician, and we've got that trusting relationship. And there's so many people. I mean, this is the journey of family medicine. You meet people who are against vaccines, you develop a relationship with them, they trust you, and then they come around and they decide that vaccines are right for them. And that is kind of the success and the beauty of family medicine. But that happens on an individual one-on-one basis. And so I always think about, how can we take that trust and those conversations and put them into the public discourse and have those conversations in community settings, in social media settings, and in traditional media settings. That's kind of what I try to do. I mean, I think that the best things that I try to do is just avoid inflammatory language and really see both sides, because I always assume the best intent. So again, people who don't want to wear masks, I don't ever assume that they're just doing it because they're trying to be political. They often think that masks are actually unsafe, or they're really uncomfortable for them to wear. And they've got reasons. People who want to keep our economy open, I am so sympathetic to them, because for a lot of people, this has financially devastated them. They're thinking about, how do I put food on the table for my family? And so it's not fair. The situation that we've gotten into ourselves, it's just not fair. And I think that's something that we have to kind of reconcile with, and really just being sympathetic and seeing both sides of all issues, multiple sides of all issues, and then trying to have a dialogue. And really that's the best that we can do right now. But I do encourage family physicians, don't shy away from those conversations, because you are going to, I mean, Mike and I know you're going to get people who send you some strange tweets and they'll direct message you some weird things. And that's okay. I think we just have to still put ourselves out there. And as long as we can stand by what we're saying and we know that what we're saying is accurate, I feel good about that.
Those are great points. I mean, like you said, you and I do a lot of media, and people are sick of seeing us. And that's why we're really trying to encourage our family physician colleagues to participate in media, participate in traditional media and social media. When you talk to a family physician who's like really revved up, and you try to empower them to do media and things, and you get resistance, how do you try to encourage them and coach them to try to, hey, you really have to share your story, because we're really kind of all in this together?
Yeah, and it really depends on the comfort of that family physician. So I do want all family physicians to share their story, but it might look different for everybody. So there might be a family physician who's more comfortable, sending letters to the editor and sending letters to traditional newspapers. There might be a family physician who feels more comfortable on certain social media platforms for their friends and family, and maybe restricting the public. But after they get comfortable, they can broaden their audience. And so it really depends. Some people are comfortable doing audio and being on things like radio. Other people are just not going to do audio or video at all, but writing. And so that's something I learned when I was in journalism, is journalism too looks really different. So people who have a passion for journalism, a passion for getting the truth out there. There's so many different mediums for people to participate in. I think the other thing that can feel daunting for family physicians is the time commitment. And again, that time commitment can look so different for different physicians. A really easy place to start is your own institution. Get involved in your own institution. I always encourage, especially family physicians who are employed, I encourage people to go into leadership. A lot of leaders in these institutions are non-medical people, and it's great for family physicians to get involved in leadership. So lots of ways to get involved. I just encourage people to go beyond what their comfort zones might be.
Wow, those are, it's just great points, and then, you and I do a lot of social media and we get a lot of feedback from family docs about that. And just like you said, I mean, it's just what your comfort level is, and you don't have to join every platform that's out there. I would focus on the one that you're most familiar with. For most people, it's Facebook. And then if you get the bug there, then you and I can really kind of coach that family physician in doing more and sharing their out story more. And that is great too for employed physicians. There are people who do this all the time. I mean, if your hospital is big enough, or if they do have a marketing department or something like that can help you, that can coach you, that can give you some talking points, or that can you start writing a letter or something that can really help you as well. So all great points.
And one thing, and Mike, sorry to interrupt, but I'll add one thing I love that you do is just amplifying other family physician voices. And I just really think that there can be a community of mentorship and reaching out. And so for people who are out there that feel like they don't even know where to get started, well, Mike and I are happy to help you, and we're happy to amplify your voice, because I really do think one of the things I love about family medicine, and I'm so thankful for, is there are so many people that are willing to help other physicians. And you see that mentorship, that sponsorship. I am always indebted to Dr. Stephen Brown. He's my residency program director. I just love him because he's somebody that has taught me, like, you reach your hand out and help other people. And then I've been able to turn around and do that as well.
Exactly. Yeah. Paying it forward. I mean, paying it forward, that has happened to all of us. I can name half a dozen mentors that have done that for me, maybe not, in the media space, but other things that really have given me the confidence to do what we're doing now. So yeah, I can now agree with that more. So as we're kind of going along here, why don't we kind of shift gears here? We talked a little bit at the top about self-care and things, and, I can't agree with you more that we do have to, check in with each other as family docs and say, hey, how is it going? I know that even for me, it was tough. Even back in the spring, we were all kind of in survival mode, and now it's easy to kind of forget about your friends, and for me, now it's summertime here in Ohio. My wife and I, we've been getting out in nature. We can socially distance. We hike and bike and try to get outside, and when it's not too hot and humid. And what are some of the things that you've been doing just to try to decompress and some of your self-care practices?
Yeah, thanks for asking about that. Such an important topic. So my husband is also a family physician. And okay, so before this pandemic, I will say the silver lining of this pandemic is we would not really cook at all. And so we were just, I don't know, I feel like we just ate like way too much Chipotle at that time. But the silver lining is we've been able to just cook so much more at home, and cook not only, like healthy foods, but also ethnic foods, which I haven't really cooked before. Like, my mom is such a great cook. She cooks Indian food. She has no recipes. It's like all in her brain. She doesn't measure anything. She just like knows by like the weight of it. And I will never be on that level, but I have been trying to cook a little bit more, spend time with my husband. We're trying to, we recently got married. I mean, moved into a house.
Yeah.
So I know, right? It was so funny. So we've just been kind of thinking about like decorating our house with furniture, and it's just and I'll tell you a really my funny husband story, which is kind of like a random story, but I didn't. So it's funny. We've been dating since undergrad. So we've been dating since we were at the University of Arizona undergrad, and I actually didn't get into med school the first time I applied, and I always love sharing that with people because there are so many people out there who don't get into med school the first time they applied, and I'm always a source to look over your CVs and personal statements, and I want to help you out. I was devastated that I didn't get in, and I was trying to figure out my journey. I decided to go do AmeriCorps in Denver, Colorado, work with homeless patients. And it was Yeah, it was really sad because that year I had to like leave my boyfriend at the time and did AmeriCorps. And it was a really tough year because I was away from my family for the first time. And I tore my ACL skiing, which that was like first world problems. And then a friend of mine came and visit me and she totaled my car. I let her drive my car in the snow. And she was from Arizona. She totaled my car. My ACL's torn. It was just a crazy year. But at the end of that year, I got into med school. My ACL ended up getting repaired. I ended up marrying that boyfriend. He's my husband now. And that replacement Toyota Corolla that I got at that time, I'm still driving it. And so it kind of all worked out. So I like to share that story because, you know, you go through hardships and it kind of works out in the end. But I've been extremely, extremely thankful. And I haven't felt, I know that there's been so many people who feel this like tremendous drain. The pandemic has been really, really hard, but I think because of the work that I do, I'm constantly inspired by the people around me, the people at One Medical, people like my husband. And so it hasn't felt like a drain. And so I'm able to just like cook and relax and hang out with my friends virtually. We've gotten really used to doing Zoom happy hours and I've really felt at peace.
Oh yeah, Zoom happy hours. Yes. Yes, we'll have to talk off camera because I can't probably share some of that stuff on the air.
Well, I mean, Cards Against Humanity is a great game to play on Zoom, as we've learned.
Oh man, that's too funny.
Yeah.
So let's see what else. So I guess kind of our closing topic, you know, is National Conference. It's National Conference Week. Mm-hmm. And for people who don't know, so this is a huge annual meeting in Kansas City where the headquarters of the American Academy of Family Physicians is. And, you know, I remember going to my first national conference, maybe it was like a second year medical student where I was like, you know, just wanted to get out of town because I was bored. And I didn't know anything about family medicine. Right. And some of my friends were going and I'm like, cool. So I started going then, and then, you know, when you first go, you go to all the fun stuff. You go to all the workshops and, you know, you put casts on stuff and then you keep going back. And for me, I just kept going back and I'm going back. And then, you know, at some point I was talking to people, really fired up people, and they're like, well, you got to go to the business sessions. I'm like, why would I want to go to the business sessions? I want to get some more barbecue and all that kind of stuff. Yeah. And then you go and then like, oh, this is where we're all, we can kind of like change the world and like, you really make a difference and change policy. And that's where I kind of got the bug. And that's where I kind of got the bug in doing leadership and all that kind of stuff. So I know for me, National Conference Week has been very, very special for me. Do you have any, you know, special kind of national conference memories that you have when these weeks like this come along?
Yeah. I mean, for me, Mike, it's so funny because there's literally people that I did not meet in real life until I met them at national conference. So it's people that I'd be communicating with on Twitter or social media. And then we'd have like these tweet ups and we'd actually meet at national conference. And so that was really great. But I think, you know, national conference, yes, it's certainly fun eating barbecue and it's fun going out and it's fun just like hanging out with a bunch of family doctors. But I do think the magic of national conference, it's meeting people in different states, kind of across the nation, who are all unified around this vision of making healthcare better in this country. And so that you can still do. So I do tell people it's going to be different because it's virtual, but I do hope that people attend national conference and they really put themselves out there to engage. And it might look different this year, but like any way that you can connect with people and just like find emails and reach out to people, I think that's going to be great. But I've had such fantastic memories from national conference as well. We ended up going, oh my gosh, this one year, I shouldn't even share this story, but we ended up going to this incredible, I don't know what happened. We went to this gay bar and it was so much fun. It was like my entire residency program. And then we ended up seeing a drag show. And that's where I'm going to end that story. But there's so much more to that story, but it was a great time.
So yeah, because I think, you know, because you guys have a big, you know, residency booth where you talk to students and you tell them about your program and things, and your program always brings out a big team of people. I mean, it's a lot of people. I mean, it's got to be a lot of fun for the program. I don't know who's working back at the ranch, but you guys bring a lot of people out to Kansas City.
Yeah, well, Arizona is so great because our Arizona Academy of Family Physicians, they're so wonderful and kind of helping coordinate. And we had this Arizona Avenue that it would be all of the different programs in Arizona, as well as my former residency program as well. So it was such a fun time because you do want to connect. I mean, I know that for a lot of people, national conference is about connecting with the program that you might spend the next 3 years at. And I think there's still ways to connect with those programs and really get a flavor for what the program's all about and understand if it's the right fit for you. And that can happen virtually as well. But national conference, when we get a vaccine, Mike, and I know it's coming, when we get vaccine, when we have herd immunity, we're going to go back and we're going to have the best time. I think that's the silver lining too, is like when we have all these conferences again, which I'm optimistic they will happen one day again in the future, it's just going to be the best.
I don't want to put you on the spot. When do you think we'll have a vaccine? You think it'll be?
Yeah, we can talk about that. I do. Yeah, so I've done some research. I was looking at all the different vaccines, the different phases that they're in. They're promising, right? And of course, the one in the US is promising as well. I do think that we will have a vaccine in 2021. I'm optimistic about that. I think the question is going to be, it will be given to healthcare providers first. I think the question is going to be, when will it be for the general public? And really, and the big question is also going to be, how many people in the general public are going to get vaccinated? Can we convince them that it's safe? Can we show them the data? And can we really get past that anti-vaccine sentiment? Because I'm already hearing that.
That's right. I'm glad this is the end of the show because then we'll watch until the end of this. But I mean, I already have patients or people on my Facebook page saying, I will never get it. And then I would come back, do you get the flu vaccine? Do you get any of your other adult vaccines? No. So I'm like, well, then there you go. So it's just, and then you're right. So when I tell my patients is what you see on television, and when I can give it in my office to you, they're two very different timelines. And I mean, and with an election year, again, everything's against political. So let's see what else. So the antibody test, I get a lot of questions about the antibody test. I think you talked about it already. It's really not ready yet. So that research is ongoing as well, as far as we're going to get to that point where it's going to be the right test. I mean, is that what you're advising patients and things?
Yeah, and we do offer the antibody test for our patients, but we're very cautious about what the interpretation looks like. So I think just for your viewers who are non-medical, there's the IgM test, and that's the test that shows up, 7 to 10 days after you have an infection, and it dwindles a couple days after that. And then there's the IgG test, and that's the test that shows up 10 to 14 days after an infection, and we don't know how long it lasts. We initially thought for other coronaviruses that IgG might last for a couple years. Now there's some emerging research that shows if you had a very mild infection, there's a percentage of those people that their IgG antibodies, they're gone in a couple of months. I think what we also tell people is whether or not you have IgG, we don't know if you're immune. And so we tell people, just because you have a positive IgG test, that does not mean that you should stop practicing physical distancing or wearing a mask or being cautious. We just tell people the IgG test, it almost just gives you information of if you had a prior exposure, and it's useful for people who want to donate plasma. But beyond that, we can't make any inferences about immunity. And immunity obviously is very complex as well, because there's the antibody-mediated immunity, but there's also T-cell-mediated immunity. So immunity is a really complex topic, but I think what we're telling people is we don't think we're going to achieve herd immunity in any meaningful way without a vaccine. So for now, antibody testing is available to you. It's useful in narrow scenarios, but it does not tell us anything about immunity.
So I guess as we're closing up here, I mean, you're doing a lot of media these days. Other COVID-related topics that reporters are asking about that we haven't talked about tonight already, or?
Yeah, I think these are the big ones. I think for what's emerging, the two big things that are emerging is the long-term sequelae of COVID. So for a lot of people, we say like people recover, right? So we've got people who are, they have the fatality rates, and then we've got the recovery rates. But even among those who recover, we're just now learning about what are the long-term effects on their lungs? Like, are people having post-fatigue from COVID? Like, what does that look like? The other really big topic is flu season. And flu season is something that we're thinking about at where I work, and what you were talking about before. How do we make sure that we get the flu vaccine to everybody? But also thinking about the diagnostic challenges that flu season will present to our clinicians. Because now you think, as a family physician, you've got someone in front of you that's got COVID and flu symptoms, very, very similar. Do you have access to a rapid test? And we know the rapid flu test doesn't have great sensitivity. And so even if a rapid flu test is negative, do you think they have the flu? Do you think they have COVID? Are you going to ever give them an antiviral for the flu, which, you know, for a narrow population of people might make sense? So the diagnostic challenges are going to be really tough during flu season. On top of that, we know flu season brings more stress to our hospitals, our ICUs, our ERs, our healthcare system in general. I think we do know from data from Australia and New Zealand that flu season has not been as bad in the Southern Hemisphere, obviously because the things that we're practicing, like masking and physical distancing, those are also effective at decreasing transmission of the flu. So I don't think flu season will be as bad as prior years. I do think everybody still needs to get a flu vaccine. And we as clinicians and physicians need to figure out how will we navigate that diagnostic uncertainty.
Yes. Wow. Let's see. What else I was going to... Oh, so, and I know I've seen you doing media on this before, is that, you know, there's still this fear, especially with my patients, you know, physically coming into the office for whatever reason, especially routine follow-ups. You know, there's been, you know, a lot of cancer screening that's been postponed or missed or, you know, delaying routine care. You know, when you talk to patients, how do you try to coach them, you know, to still kind of keep those visits and keep those cancer screenings?
Yeah, and we talk a lot about what is the looming pandemic in the future. When people delay primary care or don't have access to primary care, what will the health of this country look like? I always tell people that primary care is an essential service and it's a timely service. And so for people that have chronic diseases, or even people that don't have chronic diseases, now is not the time to delay things like getting your diabetes checked, getting your pap smear. Those are very important. Because what this could look like a year from now, 2 years from now, is we don't want to see people with uncontrolled diabetes, uncontrolled blood pressure, have things like heart attacks or strokes. And so I do want to tell people that, number one, remember primary care is an essential service, and a decreased access to primary care is a danger to our health system. I think number two is thinking about what are things that we're all doing in primary care to keep our offices safe? And that's really important for not only our patients, but also our teams. And so, you know, even in our offices, we've got HEPA filters in all of our rooms, which is great. We have universal masking of all of our patients. We, as healthcare professionals, have adequate PPE. We wear masks, we wear eye protection. We have N95 for certain circumstances. We get tested very regularly as a healthcare provider. I'm routinely getting tested. And so we want to assure our patients that we are taking adequate steps. And I've certainly had patients tell me after they come to the office, they kind of look around and they see all the safety precautions, disinfecting, et cetera. And they were like, wow, I feel safer here than I do at a restaurant. And that's something to think about, really. I think about being a server at a restaurant when those customers aren't wearing a mask and they're eating and drinking and you're interacting with them. And really, people talk a lot about healthcare providers and healthcare personnel being at risk. And I think about, gosh, there are a lot of other essential employees right now beyond healthcare providers that have increased risk of contracting COVID, and they don't have the same mechanisms to decrease transmission that we do in healthcare. So in a way, we're kind of lucky in healthcare, especially compared to people who are in food services.
It's so interesting how you say how we can show people how we disinfect and show that they're safe. And I really hope, and I've seen this too, in the manufacturing industry, they've kind of really shown that not only to their employers, but to their customers. I hope the education industry, does that as far as showing people, hey, this is how we're going to disinfect a bus or a building or a room or whatever, just to try to give the community a little bit more confidence in sending their children back to school. And it's really interesting time that we're in now, especially we've talked about social media, how we can show our communities through Facebook Live or video hey, this is how we are keeping your children safe at school. Really try to ignore a lot of what you're seeing in the news because a lot of it's politics, but this is what we're trying to do to keep your kids safe. And we're hoping that, that gets through to these parents in these communities.
Yeah. And I think, one thing that there's this idea that until we have a vaccine, we won't be safe. And I really implore people to think about, there are several other, I mean, no country has a vaccine right now, but there's a lot of countries that have gotten this under control, and they did it without a vaccine. And it's really just following sound, reasonable policies. And it's ultimately a matter of all of us need to take this seriously, put our masks on, disinfect, physical distancing. Like, there are things that we can do to get this under control. And it's not a matter of 0% or 100%. It's really a matter of like, what is that sweet spot in between that's driven by data and science, where we don't have to shut down the entire country until we have a vaccine. Like, that's not what anyone wants. And so really it's a matter of like, what do those sound policies look like? And how do we all just take this seriously?
My guest on the line has been Dr. Natasha Bhuyan, my friend, family physician from Arizona. I'll let you share some closing thoughts a little bit. I'm just going to share a little bit of my closing thoughts. As we here in Ohio, this past week, the governor did, make masks mandated. And I'm getting a lot of, feedback, not all negative, some positive from my patients saying, hey, glad this happened. So I really encourage you, to wear a mask, social distancing, hand sanitizer, all that type of stuff. I'm not perfect. We're all not perfect. Hopefully, we can all just kind of work together to try to work through this, to try to, decrease our cases. And as school is coming back, it's really important, for communities and parents to really keep good communication with your school district to see how they're going to keep your kids safe. And unfortunately, just with this, everything is political now. It's just really try to stay away from that, really try to stay focused on the science. And I'm hoping that we can continue to dialogue, and there's going to be people who are going to be yelling at each other for no reason. But hopefully, reasonable people can really just kind of come together to try to get to the common goal, which is trying to cut back the cases, cut back the deaths, cut back the hospitalization. So that ends my soapbox. So Natasha, any closing thoughts as we kind of close up our conversation on anything that we haven't mentioned, or do you want to mention as we close things up tonight?
Yeah, I will just say, I really loved your closing thoughts, Mike. And really mine is that I always think of the luckiest day of my life. And the luckiest day of my life was the day that I was born in this country, when I was born in America. And so I know that I assume the best of Americans. I know that Americans are people who are hardworking. They want the best for their friends and family. They care about others. And we have the spirit in this country that we can achieve so much. And I really hope that we reach back into what we think of as the best of America and take this seriously and try to think of your neighbors and your friends and really think beyond yourself. And that's my hope for Americans. And I know that we can all do it. Wear a mask, wash your hands, physically distance. And if you are confused, look at different media resources. Look beyond the typical media that you look at. And if you have questions, reach out to a family physician, because we're always happy to answer them the best that we can. And we'll always be honest with you.
Thank you so much for the time. This has been so much fun. Like, this hour just went by very
it flew
quickly.
by. I can't believe that was an hour. Mike and I were like, should we cut this off in 30 minutes? No, we went for an hour.
We'll definitely have you back at some point. We can definitely do follow-ups on this. If you were late, why were you late out there watching this? But this will be on the OAFP YouTube page. Also, you can watch it here on Facebook. It'll be ohioafp.org. But again, register for our annual meeting for Thursday night for students and residents. There's the Ohio only reception, foundation stuff, get your masks, all that good stuff. So thanks again for joining us. Watch the rest of our interviews here for Bite-Sized Learning here at the OAFP, which I don't know if an hour is bite-sized, but a lot of good recent conversations. You can get all of them at ohioafp.org. Till next time, I'm Mike Sevilla. Good night, everybody.
Stay safe, Ohio. Thanks so much, Mike.